So when checking in your patient, you want to check the TPR on the patient before the doctor gets to see them. So the TPR is your temperature, your pulse, and your respirations. So this kitty is really nervous. You can tell by her eyes and the way she's breathing. So I know that her respiratory rate and her pulse are actually going to be higher than they should be. Cats should be around like 100, 120. She's going to be really nervous, so she'll probably be around 180 to 200. You want to check, make sure you don't hear any murmurs or anything unusual in the heart and lung sounds. You also want to make sure that temperature isn't above like 102.7, or check in the record to see if they run high. So, check. So she breathed 10 times in 15 seconds, so I'm just going to multiply that by 4, so that's going to be 40. So she is a little nervous. So for her temperature, I'm going to take it real quick. Henrietta's going to hold her. And we're very nervous, so we're actually even having a little nervous diarrhea, which you should mention to your doctor before they go in for surgery and be aware. So her temperature is 98.6. So it may be a little lower, depending on what she normally runs. I'd have to look in the history to see if that's what she usually runs. However, I also said before that she is having a little diarrhea because she's nervous. So it's important when you're under anesthesia to check your patients every 10 minutes. Make sure you have a bear hugger or whatever you need if they need one. So the last thing I'm going to do is I'm going to check the pulse. I'm going to listen to the heart and lung sounds. You want to make sure that when you check your pet, she's very nervous. When you check your pet, you want to put your stethoscope about where their shoulder blade comes back. So I'm going to put my stethoscope about right here. And again, you want to listen for 15 seconds and times it by 4 is a little less stressful on the pet. And then you want to pause for a minute too and listen to the lung sounds as well to make sure that you don't hear anything abnormal. Times it by 4, our respiratory is actually 200. So you're very nervous. And I always like to check the gums, make sure everything's okay, and make sure hydration status looks good, and then give results to your doctor. So she looks pretty good. Her teeth. So we're pink mucous membranes are wet. So that's what you should do, and make sure to always consult your doctor if you have any questions and let them know all the results before they go under anesthesia. So now that we've done a physical exam on our kitty Juliet, we have to assign an ASA grade. So that grade is going to help determine whether we should perform surgery or not. So a grade 1 is apparently healthy, nothing seen on physical exam and nothing in the history. Grade 2 is a slight risk. It's if you have something maybe in the history of like a heart murmur or something like that, but you don't see anything on the physical exam. Grade 3 is slight to moderate. So if you feel something on the physical exam or something in the history, and you have to actually hear or see it in the physical exam, whereas grade 2 you don't at all in the physical exam. Grade 4 is moderate to severe. You see or hear something in the physical exam and they have a pre-existing condition. And grade 5 is only is a last-ditch effort. So if your patient is going to die without surgery or is in very, very critical condition, that is what a grade 5 would be. So when admitting a patient for surgery, you need to check the temperature, pulse, and respiration. So your temperature, we just use a temperature probe right here. So she shouldn't run any higher than 102. I've checked her history. She runs pretty normal.
Not everybody likes their temp checked. Just to be in good girl.
Girl. Stupid good girl. Oh, and my thermometer is taking a very long time. So we are 101.2. Alright, and so then you want to check respiration, so that's the breathing of the pet. So I like to look at their flank, see how many times they breathe in and out. So for every one breath, I like to count up, I like to go up to 15 seconds and then multiply it by 4. Okay, so 6 breaths, 6 times 4, 24. Alright, so that is pretty normal, especially for a dog. She's feeling pretty calm. The last thing you need to do is you want to check pulse. So you want to listen to the heart and lung sounds on your patient. So if you look at her elbow and you can pull her leg back where the elbow connects to the flank of the patient, that's about where your heart is. So you want to listen, make sure that you don't hear any harsh lung sounds or any irregular heartbeat or murmur or anything like that. If you do, you should consult your veterinarian and let them know so that they can take them over to before the procedure. Alright, so you got 30, so 30 times 4 is 120, so that's about normal for dogs. You also want to remember to listen to both sides of your patient. If you don't hear very well, make sure you move the stethoscope back or down a little bit. Don't be afraid to adjust it. If you hear any weird sounds, make sure that you move your stethoscope around too. That way you can try to figure out where it's coming from. That way you can also try to hear it louder to see if what you're hearing is actually irregular or if you just mistook it for something else. So now that we've done a physical exam on our dog Chanel, we have to assign her an ASA grade. So to recap, 1 is apparently healthy, 2 is slight risk. You have something in your history but you don't actually see anything on your physical exam. 3 is slight to moderate risk, so you have something in your history and you have something in your physical exam. 4 is if they have a pre-existing condition, maybe slightly serious, and you also feel something on your physical exam. And 5 is if it's a last-ditch effort to save the patient's life, and that's why you're doing the surgery in the first place. So for Chanel, there was nothing seen on physical exam. However, we know from Chanel's pre-existing history that she is a diabetic. So looking at her lab results, she is an uncontrolled diabetic, looking at her glucose levels. So we'd actually assign her a grade 4. We would assign her a grade 3 if she was a better controlled diabetic. So she's one that we would prefer not to do surgery on until we know that her diabetes is more controlled. So for induction, there are some things that we have. So we have our regular drugs, so like DKT we use on feline neuters. It's 3 different drugs, ketamine, chorbutesic, and dexdomitor that we use. We call those induction drugs. We don't actually, or not induction drugs, they're pre-anesthetic induction drugs, but we can use them as anesthetics. They knock our pets right out, and within the time that we're done with the neuters, we can reverse them, wake them up. So we use those. You can also use an induction chamber. So we don't actually use the boxes here, but what they are is it's a box. They vary in size. Some of them have a split in the middle where you can put a drawer in. So you can start with a big box if you have like a big cat or a small sized dog. Typically it is used on cats like feral kitties, and if you have a small kitten you can put a drawer in, so you can only use a smaller box. You want to use a size box depending on the size of the animal. So big cat goes in the big box, small kitten goes in the small box. That way when you hook up your box to your anesthetic machine, you are not putting in too much anesthetic. Another induction is we have these masks. So after you have put your kitty in the box and your kitty's knocked out, you can actually put this over their head. This connected to your tube, and that way they breathe in and out. This is actually the wrong set of tubes, so you would actually use this if you were just using O2. If you want to use O2 and anesthetic, you would use your non-rebreathing system. That way they can breathe in and out, and all of your gas gets reused through the circuit. That's why it's called a non-rebreathing system, or that's why it's called a rebreathing system. Pardon me. So you want to use the small on the small pets. We have medium as well, and you can use the big masks on the big pets. You don't want to use a mask that's too big on a patient because you're giving them too much anesthetic. Also, that anesthetic can actually get into the air and you can be breathing that in. So that's really important to remember. Don't forget you also have your ET tubes, so you can use your pre-anesthetic meds. Then you can give them a little propofol if you need. Once they're asleep, you can use your ET tube, and then you can hook your ET tube up also to your tubes. So once this is in your patient, hook it up like so. This isn't actually important, but we use this for monitoring, and so this is hooked up like so. So those are things that you can use for induction. So again, you have your masks, you have your boxes, you have your drugs, you can use your ET tube, and those are your induction methods. So when you're placing your ET tubes, you want to make sure that you have the right size. So there are a couple ways that you can do this. One of my favorite tricks is actually putting the opening up to the nose or the nostril of your patient. The size of their nostril is approximately the same size that your ET tube opening should be. There is actually a mathematical formula, so like 5-pound dogs are usually going to be around like 4 to 5. 10-pound dogs are usually going to be about a 6, and then so on and so forth. So, but like I said, the best way is really to put the opening up to the nostril, and that's one of the best ways you can do it. Cats and kittens are a little bit different. So kittens are usually going to be about a 2.5, and then cats can be anywhere from like 3.5 to 4 typically. Again, do the trick with the nose, and that's one of the best ways to be able to tell. So to test your ET tube before you use it, you actually want to blow up the cuff. So right now my cuff is deflated. You can see So I'm actually going to take this and put some air into it. So you can see that I'm inflating this. So we leave ours for a couple hours. I actually like to listen to make sure I don't hear anything. You can also test this by putting it in water. If you see any bubbles coming out of the water when you put your ET tube in, that is telling you that you have air coming out of your tube. Also, if you leave it for a couple hours and you feel that it's slightly deflated, then you know that you have a leak in your ET tube. You want to make sure that your cuff is deflated before you place it in the patient, and then once your tube is properly placed in your patient, you have actually inflated your tube. Do not take your tube out of your patient unless you deflate the cuff, because you do not want to hurt or irritate that trachea.
Go.
All right, so some monitoring equipment in anesthesia. So first, you have your pulse oximeter. This is going to tell you how much O2 is getting to the brain. There's a couple places you can put your pulse oximeter. So you can put it on your tongue, you can put it on the ear in between the paw pads, you can put it on the vulva or the penis. And the pulse oximeter is going to read right here. You don't want those numbers to be anywhere below 95, or otherwise you should discuss it with your doctor and let them know, or you should move your pulse oximeter just to make sure that it is in fact correct. So when you're actually putting on everything, you're going to do, you have your 3 probes here. So you're going to remember white right, you're going to put it right here on the armpit, and then smoke over fire. So you're going to put smoke here, and then you're going to put your red one right in between here for your dogs or cats. This you're going to attach to your ET tube, and then you're going to screw this in. So one end is going to go into the ET tube, the other end is going to go into the tube that connects to your anesthetic machine. So this is for your respirations. This is going to tell you whether or not they're breathing or not. Another way you can tell, you can look at your bag. Your bag should be moving in and out just slightly. You can use the bag as a manual to be able to count those. I would not always use your machine just because your machine is not always correct. So always make sure that you are doing manuals, especially if it looks like something might be wrong in your machine. So your respirations are here. So too low respirations and your patient may not be breathing, too high and your patient actually may be waking up, so you should always take care to look at that as well. So this is going to be your blood pressure monitor. So your blood pressure is really important. You don't want your blood pressure too low again, but you also don't want your blood pressure too high. Depending on what your blood pressure is like, you're going to want to change how much anesthetic is going into the patient. There are different size cuffs. You typically put those cuffs right on the legs. I don't recommend putting it on a leg that you have a catheter in, because they don't always read correctly. Your blood pressure should be right here. So it says no blood pressure, and then it says leak here. So it's right now turned on, but it's not taking your blood pressure, so your machine is confused. You want your blood pressure to be somewhere between somewhere around 120/80. So this is your bear hugger, so this is what's going to keep your patient warm. Anything below 100 and you should turn on your bear hugger. Typically, most patients need a bear hugger or Snuggies, something to keep them warm. Even hot water bottles with covers on them keep your patients warm. So what you're going to do is, this connects to the tube here, and so you're going to turn it on, and then you have different settings, and it's going to fill with air, and it's going to surround your pet and keep them warm. There are also ones that are flat on the ground, so you can put them on top of it. And again, you have Snuggies, which are like little round discs that you can put in the microwave for 8 minutes or however long they need to be put in, and put your patient under or around them. And again, hot water bottles you can put on the side. You want to make sure you have covers on those too, though, just so it's not too hot for your patient. You also have a temperature probe. So we actually have one that connects to the machine, but we don't have it here right now, but that will tell the temperature here on your machine. You also can use a regular thermometer. These are rectal thermometers. So you put them in the anus, you do not put them in the mouth like people monitors. And then there's esophageal stethoscope, which I do not have one here at the hospital. However, they look like a regular stethoscope, except for they have like a spherical rubber piece at the end, and then you're going to put them down the throat. Your patient has to be anesthetized before you do this, because obviously they will chew the rubber and then they'll end up getting caught in their throats. So your esophageal stethoscope is going to count the heart rate for your patient. And your heart rate is also here, where your ECGs or EKG, electrocardiogram, and that tells you the electrical activity in the heart. You want to make sure that the heart rate is below a certain number. If your heart rate is too high or low, your machine actually is good and it pops up with a red and it beeps at you. However, like I said before, you don't want to you want to make sure that you're doing manuals as well, so putting your hand on the patient's heart and feeling for those beats, because you shouldn't always trust your machines. So when you're leak testing an anesthetic machine, you want to make sure that your pop-up valve is turned closed. If it's not closed, you're not going to have the test done properly. You want to also make sure that your bag is put on correctly, and you want to make sure that all your tubes are connected. You want to put your finger over the opening of your tube, and you want to make sure that you turn your O2 on. So now that your O2 is on, put your finger on the tube and you want to hit your flush valve. So you want to see that your bag is filled up, and you want to see that that bag holds. I like to listen, so if you actually can't really hear it, but if you can listen, and I can actually hear water coming out of this valve, so I know that I need to replace at least this piece. So what I'll do is I will replace this piece, put it in, and then I will make sure that the whole system is functioning the way it's supposed to. So again, I'm gonna one more time put my finger over. So this bag is holding pretty steady, and I'm gonna actually listen to make sure I don't hear air coming out of anywhere else except for this piece. So see, this bag still holds pretty well. I'm gonna let go, and you have leak tested properly on your non-rebreathing system. Your rebreathing system is not necessary to test, but we'll come over here real quick. So you wanna make sure that you have everything. So you want to make sure your bag is connected properly with your tubes. You're going to turn the O2 on for here as well. You're going to put your finger over the top, and you're going to hit your fast flush valve. Hold your pop-up valve. You want to make sure that you don't hear or see anything. So I don't hear anything leaking. Like I said, your non-rebreathing is really what you need to test, but you at least want to make sure that your O2 is running properly. That's why you want to do this. So on a jugular blood draw, you want to make sure that you find that point right between the shoulder blades. It's actually a little bit above the shoulder blades. It's easier to see when they're sternal, but that's where you're going to hold off. I've actually already put alcohol on my neck here, and I can actually feel my vein, which is right here. You feel it pop right between your fingers. You want to make sure that you're really careful so that you're not hitting the trachea or anything else. So I like to make sure my needle's a little bit bent, and you want to make sure you draw back on your needle. You want the bevel to be up on your needle, and again, I'm going to just feel one more time. Right here. So that was going to be up, and you're really going to feel that needle pop into the vein. I don't need a lot for this test that I'm doing, but then you're going to hold off really, really well for a jugular blood draw, and that's how you do that. So I'm doing a blood draw on a cephalic vein, so I like to put my thumb right alongside that vein, so that way that vein doesn't move, and you should feel that vein pop right underneath your finger. So it's right here. I've put a little alcohol on it. You have somebody holding off, so make sure the bevel is up. You should see that flash. Good boy. You're being so brave. Oh, you see that flash? Alright. And you've got your blood. Alright. Alright, so I'm going to do the blood draw on a saphenous vein. So the saphenous is in the back of the leg. I've actually already put alcohol on this. You want to make sure that you put your finger right next to the vein. That way the vein is stabilized and can't roll anywhere. And you want your bevel up on your needle. Good girl. Good girl. You've got thick skin, buddy. You want to make sure you see a flash. And then you've got your blood. So I'm doing a jugular stick, so your holder's gonna hold up the head and pull down the legs over the table. This is the best technique to find your jugular. You want to make sure that you feel around the whole area to make sure that you're not gonna stick in the wrong area. You want to make sure you press right between where the legs come together. And right here, I've already actually put alcohol on my area, and I like to bend my needle just slightly. Got a grip on her still? Alright. I want to make sure that you're closed. You want to wait to see that flash before you. Well, and I see a flash, but I have to go back slightly because I did not. Alright. And that's your jugular stick. This is a cephalic blood draw on a kitty. Your holder is going to hold off right above the elbow. And I like to keep my thumb right next to the vein. Make sure the bevel is up. Make sure you see that flash. Oh, looks like I've lost it. There you go. Alright, I'm going to do a medial saphenous draw on a kitty. Make sure your bevel is up. I've already put alcohol on this patient. You see the vein right here. I like to put my finger right next to the vein to make sure the vein doesn't blow. Alright, and you see the flash. Oh, I lost it.